Okay, hello everyone. So thank you for joining us to this virtual side event, Water for Climate Mental Health Resilience for the United Nations Water Conference. I'd like to share this video. Wait. Everyone can see the screen?
Yes.
Yes.
Okay, perfect. So I'm Sanae Okamoto, researcher and a psychologist at the United Nations UNU-MERIT. Today, we are delighted to have this important event with a number of distinguished panelists. We would like to start the session with the words of welcome by Director of UNU-MERIT, Professor Bartel van der Walle.
It's my pleasure to extend a warm welcome to every one of you. Today we have gathered in a session to address one of the most pressing global water crisis. As we all know, water is a precious in all life. Yet due to climate change, rapid urbanization, population growth, water scarcity, mitigating impact that include a variety of
Sanae, can you increase the volume, please, for Bartel's
session
speech?
provides us with an opportunity to discuss and collaborate on the needs for assessment and solutions to ensure the well-being. I therefore hope that this session will be an enriching and insightful experience for all of us, and that we will leave with a renewed sense of purpose and commitment to address the challenges ahead. Thank you for joining us, and let us work together towards a sustainable and healthy future for all. Thank you.
Thank you very much, Bartel, for the very valuable message. Our relationship to water is simple but complex at the same time. Too much is not good, but too little is also not good. And we also need water quality. Due to the growing impact of climate change, water-related risks have increased in quantity, but also in intensity. Inevitably, these events affect our planet, but they also affect our minds. Just in the last years, researchers have started to point out the multifaceted impacts of climate change on our mental health. Since then, several newly coined terms emerged, such as climate change anxiety, and have been catching quite some media attention. However, mental health care support from our public services is very often inadequate or missing. The situation is especially worse in the regions where the basic health support system is lacking, or where mental illness is considered as cultural taboos or personal weakness. Existing vulnerabilities and inequalities would also intensify the impact. Taking care of mental health is not trivial, as it affects not only how we feel and think, but also how we handle stress, relate to others, and make right choices and life decisions. It is important at every stage of life, from our childhood through adulthood. This session aims to bring awareness to the complex nexus of water climate risks and mental health to co-create a resilient future in the society and within ourselves. And we also try to support establishing an evidence-based policy to address integrated water strategies in climate planning. The session is co-organized by the tri-institutional initiative of Climate Resilience Initiative. 4 of us from 3 UNU campuses in Belgium, Germany, and Netherlands have been working together since 2021 to address psychological responses and preparedness towards climate risks and water disasters. My colleague Nidhi from UNU-CRIS will be the main moderator, and I will be the session co-chair. Rob from UNU-EHS will give us a closing summary, and Kariuki will support the technical operation. This session will be opened by an opening keynote speech by the UNU Vice Rector in Europe and Director of UNU-EHS, Professor Xiaomeng Shen. Then we will have a panel session with flash talks by the panelists, and then continue to the open discussion. Please also provide your comments or questions in the chat function so we can discuss these during the open discussion later. First, I would like to give the floor to Professor Xiaomeng Shen. Dear Xiaomeng, the floor is yours.
Thank you so much, Sanae, and thank you very much, colleagues, for organizing this session. Hello, everyone. Good morning, good afternoon, good evening. I don't know where you are. I hope you are well. I'm very delighted to attend this session to discuss such an important topic, climate change and water-related distress and mental health. As you all know, water is a very precious resource. I am sure that every one of you has made such experience by sitting at a peaceful lake or just on the beach to enjoy the healing power of water. But now, water resources is not only about our survival, about ensuring our physical health, but also it impacts greatly our mental health. Water scarcity extreme events like flood, storm, water pollution have a significant impact on the mental health of communities. And in face of such extreme water events, vulnerable communities, they will lose their income and their assets, and they will live in water-related distress. And these kind of conditions lead to anxiety, depression, and stress, among other mental health issues. Loss of lives of family members or friends will give you a traumatic experience. And this experience will be a long standing experience which you need to tackle actively and to seek psychological and psychiatric support. Water crisis also leads to conflict and replacement, which in turn cause psychological distress and affects people's well-being. It is not uncommon for people living in water-scarce areas to suffer from anxiety, depression, and mood disorders as they struggle to cope with such difficult circumstances. We work all towards achieving the Sustainable Development Goals, in particular SDG 6. It is quite crucial to address the water crisis and its impact on mental health. Water-related disasters are not only a humanitarian issue, it is also a mental health disaster and mental health issue that affects millions of people worldwide. According to WHO, even now 1 out of 8 people suffer from mental health disorder. According to a UNDP report from 2021, 6 out of 7 people worldwide feel insecure. Water crises are only exacerbating such mental pressure. To address this crisis, we must work together to promote sustainable water management and practices, and provide in the same time psychological support to those affected by these crises. We also need to train or educate communities about the importance of water conservation and raise awareness about the connection between water and mental health. United Nations University has taken lead to investigate some of these aspects in the framework of its climate resilience initiative in response to the 2021 European flood events and beyond. The first joint session on this subject took place actually last year at COP27. I'm very delighted to see today that this effort is being continued. It is really time for us to take actions and work together to make sure that everyone has access to mental health issues, and especially if these are related to water caused mental distress. So I'm really hoping that with this session, we will have inspiring discussion and debate about this issue and to find ways to support people with mental health. Thank you very much. Wish you a very successful session.
Thank you very much for the
So will you be showing a list of maybe as we, Sanae, are you showing some slides here?
Yes,
or?
yes,
Okay.
sorry, there was a bit technical difficulties. Can you see my screen now?
Yes.
Okay, perfect. Okay, thank you very much, Xiaomeng. Now we continue to the panel session. So first, we are delighted to welcome here the global experts who will share their valuable insights from different geographic regions, gender and vulnerability issues. We have here Tahseen from Glasgow, Caledonian University, Dee-Ann from Government of Republic of Anguilla, Deodata from Government of São Tomé and Príncipe, Amal from UNU-CRIS, Shen from Green Hope Foundation. And after then we have the voice from practice, Matteo from Italian Institute for Planetary Health, and Kenneth from Imo State University, Nigeria. And then we have a final set of panelists from disaster risk reductions, emergency responses, and water insecurities. Jacqueline from UN Major Group for Children and Youth, Dominda from UNU-ViE, from iCatalyst. And the panel session will be moderated by our colleague Nidhi from UNU-CRIS. Thank you very much. I stop screen sharing.
Thank you, Sanae. If it's okay, then I'd like to again welcome all our panelists, all the participants. It's a great pleasure for me to be moderating this session on this topic of mutual interest that brings us together to discuss this utmost relevant topic. And as we navigate through the complexity of water health, particularly the water mental health nexus, it is important that we are having this conversation together. And given this whole big spectrum of panelists we have on the screen, it will help us to understand different perspectives and viewpoints. So without further ado, I'd like to call upon my first cohort of panelists, starting with Professor Tahseen Jafry. Tahseen, the floor is yours.
Thank you very much, and a very good afternoon, evening, or indeed a morning, or wherever you're connecting us from on this very much needed conversation on water for climate resilience. And my thanks to UNU-MERIT, CRIS and EHS for pulling this much needed conversation together. So to frame my intervention today, let me start by giving 2 or 3 quick sound bites. There are more people now without access to water than in the early 1990s. In a recent study of cities in 2019 in the Global South, the number of residents who lacked access to piped water has increased by more than 200 million since 1990. Fast forward a little bit to to 2022 in the State of the World's Drinking Water Report noted that 1/4 of the world's population are left behind in terms of access to safe drinking water, noting inequality as an issue. These statistics correlate with research we've conducted ourselves at the Centre for Climate Justice in Malawi and Zambia in 2016, where we unearthed that complex and confusing structures for water resource allocation in itself and the management of such structures are undermining efforts for better water access, especially by the poorest and the most vulnerable communities in rural and remote areas. And now, as we gather for the 2023 UN Water Conference, we're reminded of the fact that global targets have not been met, in particular for SDG 6, ensuring availability and sustainable management of water for all. The problem is, of course, exacerbated by climate change and the impact of extreme weather events. The Horn of Africa experiencing extreme droughts, whilst other parts of the world are seeing unprecedented rainfall, such as recently in Pakistan. So when we talk about climate-induced water crisis, what are we really looking at? It is, of course, a multitude of things. And at the heart of it is looking at water as a resource. And secondly, what is the water being used for? Agriculture, industry, domestic use. But in particular, to guarantee human survival and safety for water, for humans, human consumption of water is absolutely paramount. And there are some global evidence which suggests that water insecurity has an implication for the psychosocial well-being and survival and safety of people. And let me point to 2 or 3 examples. In Ghana, the distribution of water resource in cities references inequality as a key driver of distress. Research conducted way back in 2014 revealed that flood victims of the 2010 Pakistan floods experienced post-traumatic stress disorder. Similar findings were revealed with flooded communities in northeastern Thailand. And more recently, research conducted in Kenya has revealed that water insecurity is associated with diverse mental health outcomes. So what does this all mean to pull all this together? Having conducted research myself on mental health impacts of climate change and extreme weather, I know that this is a whole area that is underfunded, and thus the data and knowledge that is out there is fragmented and very thin on the ground. But if the Water Conference this year really wants to make progress on the missed targets of the SDG goals, then in terms of strategies to tackle this knowledge gap, we need more evidence in this research area. Overall, health, specifically mental health, must be included in initiatives that look at resilience and developing coping mechanisms for people and society at large. And the challenge therein lies in establishing not only that baseline, but I would point to 2 or 3 concluding points. I think I would like to see a universal human right of all citizens to have safe and sustainable water supply. I think what's important is access to adequate water supply in both quantity and quality for drinking purposes is provided at reasonable distance of users and household settings. What's important is that we really navigate around the corporate takeover and the privatization of water as a resource. I think that needs to be addressed. And herein lies my final point, which is around ownership and governance. In our research that we conducted in Malawi and Zambia, the ownership of water points is an ongoing challenge involving politicians, traditional leaders, and communities. And this ownership and affirmation of authority over water from a multitude of stakeholders is at a critical point in terms of how it affects those who have access to or don't have access to water. So what I would like to see in terms of what all this means is active participation in the conception, execution, and the sustainability of water projects as a whole. And that for me is absolutely pivotal to address climate justice through the lens of procedural justice, ensuring that the voices of those are heard and acted on. So I hope I've provided some sound bites to kickstart this discussion ahead. Thank you, Nidhi.
Thank you, Tahseen. That was a really comprehensive and aggregated message to get us started on this discussion. Really appreciate you giving examples, both qualitative and quantitative, to highlight the issue we have in hand on multiple water crisis settings. Then in continuing with the insights from different regions. So I'd like to see if Deodata is here with us. Deodata, would you like to switch on your video and make your intervention? In case that you're having a technical issues, then we'll move on to our next panelist, and we'll check with you in a while. Okay, I can see screen sharing. Okay, I think in case you're having technical issues, maybe we move on. Oh, I can see you, Deodata. Can you hear us? If you can unmute yourself and... Okay, so I think maybe we go to our next panelist. Deodata, I'll come to you next. Please stay with me. And welcome to the session. We have Dee-Ann, Kentish-Rogers, Minister of Education and Social Development at Government of Republic of Anguilla. Thanks for joining us, Dee-Ann. And please, I'm kind of putting you on the spotlight to make your intervention.
Yeah, I'm trying to
Deodata, I will come to you in a while. So
yeah,
I've just
I'm trying to connect, but it is not possible. That is why I'm...
Hello. Okay, I'll just mute. Okay, and please go ahead.
Thank you. Good morning, everyone, and good afternoon, depending on where you are. To the distinguished delegates and esteemed ladies and gentlemen here this morning, it's an honor to address
is the WASH assessment
2020. Hi.
Hi, yeah, please carry on. I'm just trying to coordinate with our other panelists who's facing some technical issues.
Okay, no problem. It's an honor to address the UN Water Conference on the topic Water for Climate Mental Health Resilience, Integrating Inclusive Water Strategies in Climate Services. Today, I want to focus on 2 points: building climate mental health resilience with a firm eye on equity and climate justice, and addressing the intergenerational impact of weather, water, and climate change on young people. As we gather here today, we cannot ignore the fact that small island developing states and communities like Anguilla are saddled with disproportionately high burdens in relation to the harmful impacts of climate change. Places like Anguilla in the Caribbean often receive very few resources for recovery from the impact of major storms, which cascade into disasters of longer magnitude and intersect with other crises like COVID-19. It is well established that disruption of economic activity, physical infrastructure, and social systems undermine psychological well-being, worsen health, and exacerbate known risk factors for mental disorders. It is therefore imperative for climate investments to flow to small island developing states. Known spin-offs from catastrophic climate events like hurricanes have included migration from Anguilla and other Caribbean territories, and the informal reporting of increased psychological disorders and anxiety. This brings me to the second point: in relation to the intergenerational impact of weather, water, and climate change on young people. Children's bodies and minds are developing and therefore much more susceptible than adults to the effect of environmental stressors. Environmental and climate justice, therefore, cannot only be considered by geographical space, but also through the dimension of time and across generations. For instance, data from Anguilla's Ministry of Health demonstrated in 2019 that 50% of students struggled with undiagnosed anxiety and/or depression, and 30% of all students aged 13 to 17 had suicidal ideations. This is a concerning trend that demands our attention. Assistance is greatly needed with developing the strength of our mental health professional support services, within which Anguilla is limited to one clinical psychologist, already limited in the proportion of the population that can be assisted. However, support through the increase in the availability of counselors and cross-jurisdiction registration of mental health professionals can assist in alleviating the gap that exists between the current supply and demand for mental health services in these small island developing states. We must recognize the urgency of the situation and take immediate action. Climate investments should not only be channeled towards physical infrastructure and environmental protection, which are necessary, but also towards mental health support services. Equity-minded leaders who have the positional authority and resources must respond to the calls for change. They should recognize indigenous knowledge and ensure that a percentage of the benefits of climate investments go directly to countries on the front line of the climate crisis, and specifically to children and disabled population. This also requires these leaders to share power and bring countries at the front line to the front line of discussions around financing mental health for climate resilience. As we strive to build climate mental health resilience, we must not forget the importance of equity and climate justice. There is a need to take a holistic approach that considers the physical, social, and mental well-being of our communities, especially those who are most vulnerable. We cannot achieve our sustainable development goals if we do not address the root cause of environmental inequalities. In conclusion, I call on all of us to act with urgency, to build resilience, and to ensure that our efforts are inclusive, equitable, and just. We owe it to ourselves, to our children, and to future generations to take action now. Let us work together to create a better, more resilient, and equitable world for all. Thank you.
Thank you, Dee-Ann. That was really inspiring, and it gets us actually really triggered to coordinate our efforts for meaningful actions. And I'm grateful that also you could represent the specific interest of small island developing states in this discourse that is often under-reflected in such high-level political discussions and meetings. But we are grateful that we have you on board for that representation. And with those words, I'd like to call upon my colleague, Dr. Amal Sarsor from UNU-CRIS to please present her research on this topic. And then I'll come back to you, Diodata. So please stay with me.
Hello, everyone. Good morning, good afternoon, and good evening for everyone, everywhere you are. Do you see my screen now?
Please put in the presentation mode if you can.
Yes, perfect. Yeah. Thanks for being with you today, and let me take you to the other part of the words. Here I'm going to talk about distinguished area which facing not just only water stress, climate change. We are talking about the occupied Palestinian territories. As you can see from the map, that occupied Palestinian territories includes West Bank, East Jerusalem, and Gaza Strip. Following the arrows, you can see that Gaza Strip, the small area, the coastal area, is already fully controlled by Palestinians, while West Bank, which is divided into 3 areas, is controlled by Israeli side and Palestinian Authority. But unfortunately, if you will see the rose color, it's fully controlled by Israeli side, which constitute more than 60% of West Bank, and Area B, which already mixed by controlled by Israeli side and Palestinian side, which means that we have here more than 80% of water resources is controlled by Israeli side in West Bank mainly. According to the arrows, you see that the groundwater flow already comes from Area C, which is fully controlled by Israeli side, as well as Area B, in addition to the downstream of coastal aquifer to Gaza Strip is controlled also by Israeli side because it comes from Israeli side to Gaza Strip, which means that it increased the challenges of water security from geopolitical situation, environmental situation, financial and social aspects, and led to what we call water stress. If we are quickly compare between water consumption between Palestinian citizen and Israeli citizen, we can say that unfortunately, Palestinian consumption for water per capita per day is less than 100 liters per capita per day, which already asserted by the WHO standard, and they consume around 48 liters per day. In some areas, it will be 50 liters, other area, it will be 20 liters per capita per day, while in Israeli side consumption, there will be 4 to 5, 6 to 6 times more than this figure. Added to these challenges, we are talking about climate change, which exacerbates the situation that occupied Palestinian territories locate in very hot area and also considered with water scarce region, which affect, of course, on the mental health and well-being of Palestinian citizens because they are suffering from injustice of water allocation, added to climate change consequences affecting on their mental health. When we are talking about climate change, unfortunately, it's not gender neutral, which means that the most vulnerable group to climate change are women, Palestinian women, which of course buried their intervention or their involvement in climate resilience and affected on the whole community, not just only on Palestinian women, which means that we need more focus on Palestinian, on the occupied Palestinian community in general, and mainly on women to build their resilience, to strengthen them after building solid body of evidence about the situation of water stress, climate change, and its consequences on their mental health. However, recently there was more focus on the situation in the occupied Palestinian territories, starting from water crisis, climate change, and its health consequences, including mental health, by international media, national and local media also, by specialists, by UN agencies, the WHO reports, which all talk together about water crisis, climate change, and its health consequences, including mental health and well-being. Also, we at UNU-CRIS, we already recently published an article entitled Options and Strategies for Replanning Water and Climate Security in the Occupied Palestinian Territories. We also conducted a working paper about the climate change impact on mental health, preparedness, and policy interventions to support affected individuals and communities, and its publication in a process. Also, we have ongoing joint study. We are preparing for a joint study with UNU-CRIS and UNU-MERIT about climate change, mental health, and well-being to mapping challenges and opportunities for Palestinian women, which means that we need more focus on the situation to highlight the situation, the actual situation in the occupied Palestinian territories, and to ensure that we will achieve SDGs and to strengthening Palestinian community for climate resilience and also to face the challenges of water stress and to release their mental health.
Thank you, Amal.
Attention.
Thank you for giving us a vivid description of settings in most vulnerable settings of conflict, where the challenges are much more intense than in mainstream situations.
Yeah.
Now, I think we are ready with the presentation of Data, who's been waiting patiently with us. Kariuki, can you project it on the screen, and then maybe Data can make his intervention accordingly?
Okay. good morning or good afternoon, sorry. I was presented or I'm presented the WASH assessment 2021 sanitary infrastructure in Sao Tome and Principe. Then please, is regarding water issues, including the environmental cleaning, sanitation, and any hygiene. Next, please. The situation is that the objective of that study is to realize the complete evaluation of the sanitary structure in the scope of water supply, sanitation, environmental, and hygiene, in order to draw up a plan to improve the quality of service in the health facility with the mental health coverage. Each area is separated based on WHO and UNICEF guidance and initially indicator that they target and achieve the minimum standard needing and to maintain the safe and clean water as environment. It means that the green one is that it is normal, and the yellow is the partial. It not complete, but the partial one, and the red one does not complete according to the WHO and UNICEF rightly and the law. And the comment final according to the evaluation we made about that 3 colors. Next one. First of all, we organized or we made approach with the consultant person, and later we chose the according experience area of the infrastructure or sanitary infrastructure that can have a bad situation. But after that, we make a technical evaluation with a group of worker, health worker person, health worker technical person, and then we made a collection regarding 43 health infrastructure. After make a collect of information, we went to the office, make analysis, and make some evaluation at all according to data collected, and make a validation, then made a report and submitted to the financial engagement, local and international with partners. Next. Those are the posts we made the evaluation, health post, health center, and some hospital. We made it on 2 hospitals, Central Hospital in Sao Tome and the Principe Hospital also, apart the posts, health post and the health centers, about 43 infra health structure. Next. This is the data we collect, an example of data we collect regarding the sanitation situation, water not available in post of center, including the condition to make a wash hand, and the environment sanitation. We collect those information at every 43 post or health infrastructure. There is a resume of the collect of information, but we could collect information from every post, every health, but I just get that small data to make a presentation that the particular issue we collect in the evaluation situation. Next, please. And the main result, we got an example of a post Porto Alegre post just to get a sample. We see that regarding there are the places that are 40%, another one about the 33.33% regarding the other issue. I'm not looking well, is about the 13.33, and regarding the water about the 37, suppose something percent. This is after collected information. We evaluate, we got the information complete according to the analysis of information collected. We make evaluation and we saw that there is the percentage we got in the terrain during the time we made the evaluation. It means the information basic that we got regarding the water and the situation that the water can cover, sanitation, hygiene, environment, and hygiene, because the lack of water, it is depending, and we got that percentage to cover that health situation. Next, please. Then we got the recommendation that we understood that the government should be engaged even with the national institution and with some partner international and the group of private people, just to reduce the negative impact of mental health in national level. And then there are other things after made that thing, that the evaluation and that analysis, we could understand that we should make a monitoring and they make after implementation or to implement the situation or this policy, because after collect this information, we need to make some plan to implement it, but we need to engage of the government and partner, even private and community and NGO. And we need also the technical support and the material financial resource and to make in place the situation regarding the wash and to put the national level health on the better situation regarding the mental health overall. Please.
So, dear Jachap, thank you so much for your intervention.
Yeah, there is a resume I made. Thank you so much, but with some arrange, I'm sorry also.
No, everything is fine. Please stay with us for the question and answer part of the session. And for that, Ms. Kekoshin Basso from Greenhoe Foundation, Canada, will conclude this part of our section with her intervention.
Okay, thanks so much.
Thank you very much. I'm delighted to be here today to share this virtual platform with all of you. Good morning, good afternoon, and good evening, everyone. And to speak about a topic that is very close to my heart and the work that my organization and I do. Now, as has been reiterated by all of our panelists here today, water is really at the heart of the climate crisis. We have more than 2 billion people worldwide who don't have access to clean drinking water, and roughly half the world's population is experiencing water scarcity for at least a part of the year. And for us at Greenhoe Foundation, as an organization that has been working for more than a decade now with communities that are on the front line of climate change, we are witness to how women and girls are disproportionately affected by poor access to water, healthcare, sanitation, hygiene services. And without safely managed water, sanitation, and hygiene services, WASH, women and girls are way more vulnerable to attack, to abuse, to ill health that is affecting their ability to study, to work and live with a life of dignity. And that's affecting not only their physical health, but also their mental health. It's taking a severe toll on their mental well-being, actually. And across the global south, and especially in rural areas where most of our work is focused, women and girls have the main responsibility of fetching water. And climate change is making this chore even more tenuous with every passing year. It's time-consuming, it's dangerous, it's a physically and mentally demanding task, and more often than not, these journeys make the women and girls severely vulnerable to attack and often precludes them from going to school or from earning an income. So it is these vulnerabilities that we at Green Hope Foundation are seeking to address, developing and implementing solutions after years of grassroots research, leveraging clean energy innovation to resolve water insecurity through a feminist lens. So I will be sharing 3 case studies of our work today, starting with Bangladesh, moving on to Kenya, and finally ending with Kiribati. So in Bangladesh, to resolve water insecurity in severely climate vulnerable communities and to alleviate the mental stress, and we have installed deep bore tube wells. And prior to this installation, the children, the women, and the elderly used to suffer from and even die from mysterious diseases that were caused by drinking contaminated water. And in fact, these pollutants would actually affect the pregnant women adversely, resulting in pregnancy complications and birth defects. So it not only affected them, but also impacted the next generation. So through the installation of these deep bore tube wells, Green Hope Foundation was able to provide them with clean, arsenic-free water, breaking this cycle of generational trauma, which in turn has improved their mental health as well. In Kenya, in the extremely climate vulnerable rural communities that we work in, the girls have to walk under the harsh rays of the sun towards a water hole every single day with a heavy pot balanced on their delicate heads in their daily elusive search for drinking water. And unfortunately, this daily ritual gets longer and more arduous with every summer due to climate change. And in addition, they have to fend off wild animals, human traffickers, so as to really reach home safely with that precious water. And that in turn impacts their mental health tremendously. So we have distributed biodegradable water containers for storing water for the rural youth in Kenya so that the children, and especially the girls who usually have to trek half a day to collect water, do not have to miss school to bring water for their families, which in turn benefits their physical and mental health. And finally, Green Hope Foundation has just installed a solar water farm in the small island developing state of Kiribati. This is a very unique technology which uses solar power to harness rainwater and groundwater to provide clean water to the local community there. Now, Kiribati has been facing severe drought in recent years that has caused a decrease in rainfall. And this particular community has had the added challenge of facing an influx of brackish water, which is affecting not only the physical and mental health of the people because it means they cannot drink clean water, but it's also making sure that they cannot practice any kind of agriculture, let alone sustainable agriculture. And so their food security is being affected by this water insecurity. So what we've seen there is that the water management practices, again, usually fall in the women's domain, and it's affecting them adversely, particularly their mental health. And with the solar water farm and solar distillation system installation, we were able to create water security for the community and positively impact the mental health of the women, particularly in this climate vulnerable community. One thing that I would like to mention is that in all of these communities, we as non-state actors are the sole warriors confronting this crisis. And if if we really want to upscale solutions and actions for water security that take into account feminist climate justice, mental health, and gender equality, we urgently need policy support as well as state intervention, without which this crisis might spiral out of our control. We all know that life on Earth depends on water, and thus for the health of our women and girls, and for the health of humans globally, whether that's mental health or physical health, we must act decisively now, because otherwise our future survival is at stake. Thank you.
Thank you, Kekushan. This was a very good overview from our first set of panelists, giving us insights from different geographies on different gaps and needs that apply in a specific context. With that, let's move on to some practitioners who've been working with communities on giving them some kind of counseling or solutions, and in very specific settings. So first I have on my list is Dr. Matteo Innocenti. He's a psychiatrist and a psychotherapist with Italian Institute of Planetary Health and Italian Climate Change Anxiety Association. He's closely associated with it. And he's going to give us some insights on what kind of people, communities, what kind of challenges do they approach him, and how is he counseling them to mitigate some of these contemporary challenges linked to water, environmental, and climate crisis. Matteo.
Good afternoon, everybody. It is an honor for me to attend this panel, and I would like to thank the United Nations University for inviting me. Today, I will briefly explain how climate change affects not only directly, but also indirectly mental health. And briefly introduce you the concept of environmental emotions. As a little background, you know that mental disorders are recognized as a global emergency, and nearly 1 billion of people worldwide are now suffering from some form of mental disorders. But there is a problem that, as stated by the last IPCC report, the rapidly increasing climate change poses a rising threat to mental health. And water scarcity, it is one of many linked stressors increasingly likely to affect mental health through several mechanisms, both direct and indirect. As regard to direct effects could be stress and insecurity, displacements and migrations, and effects of dehydration and increased levels of violence and risk of aggressions and suicide. Water scarcity may also affect mental health by increasing the risk of land degradation, famine, malnutrition, spread of diseases, heat waves, and reduced air quality. But this scenario could also indirectly affect mental health of millions of people worldwide by increasing their level of concern. Now I show you the direct and indirect effects of climate change and climate change related effects such as water unavailability. The climate change related concern, it's a psychotherapeutic state. Psychotherapeutic states are defined by Glenn Arbet as a series of positive and negative emotions related to climate change and the overall contact with the environment in general. The most affected people are youth and women, and the most studied environmental emotion is climate change anxiety or eco-anxiety. Eco-anxiety is defined as the chronic fear for an environmental cataclysm resulting for the irrevocable impacts of climate change and concern for the future and the next generation. Another negative environmental emotion is solastalgia, that describes a maelstrom of despair, sense of loss, and nostalgia that people feel when the environment that is most familiar and dear for them has changed irremediably due to climate change effects. This emotion is widespread, mostly in MAPA, together with another emotion that is ecological grief, that is an emotional state of mourning following environmental degradation connected to disasters and depletion of ecosystem resources. And so there is another emotion that is eco-paralysis, that is a more severe condition characterized by a sense of hopelessness and distrust when facing ecological threat. In many cases, eco-paralysis is a consequence of eco-anxiety. People affected by eco-paralysis are not able to be resilient to climate change and to adapt pro-environmental behaviors that are defined. All possible action aimed at avoiding damage and or safeguarding the environment, both in the private and the public sector. Eco-anxiety plays a crucial role because it simultaneously has two different effects on individuals. It directly encourages the pro-environmental behaviors, but indirectly may have a detrimental effects of pro-environmental behaviors. Such eco-paralysis, especially in those people with low levels of self-efficacy. Self-efficacy is the self-evaluation of being capable of adequately managing stressful and challenging situations in order to achieve expected results, accordingly to Bandura. In our model, we believe that eco-anxiety is an unavoidable emotion bound to spread exponentially in the next few years, mostly in young people and in women. And we firmly believe, and the results of our studies confirm this, that climate change related communication should not be aimed at avoiding generating eco-anxiety, but rather at helping people develop coping strategies such as pro-environmental behaviors, such in turn foster self-efficacy and reduce the risk of sufferings, not only of eco-anxiety, but also from eco-paralysis. Thanks for the attention.
Thank you, Matthew. That was a very interesting message on boosting self-efficacy. And the point is well noted for all our participants as well as panelists. With that, Professor Kenneth Yongabia-Chang, the director of a research group at Imo State University, Nigeria, will also share his insights of working with remote and vulnerable communities in Cameroon, Nigeria, and that region. Welcome, Professor Ken.
Thank you very much. Thank you, everyone. I'm very, very delighted to be here today, and I'm very happy and thankful to UNU, CRIS, and UNU-MERIT for giving me this opportunity. Good afternoon, good evening, and good morning to everyone there. We are basically very much aware and feeling the impact of climate change, and especially how it hinges on mental health, which is not very clearly known, especially among our people here in Sub-Saharan Africa who are feeling the pinch but are unaware to see that nexus and connect, the strings together on how climate change is really affecting their mental health, but yet they are actually experiencing such mental health as well as physical challenges. So we are basically focused on our work on developing a toolkit for community climate resilience for water conservation. Next slide, please. So basically, there is a lot of changes in climate, especially climate variability, where we are experiencing long droughts and unprecedented rainfalls and flooding and all whatnot. And this is very, very prominent in sub-Saharan Africa. And then, of course, this has really, really exacerbated so many other mental health challenges that our people are facing. They are living under poverty. They have political, socio-political challenges. And of course, this mental health is also linked to that. But then the climate change is, and the inability to meet the determinants of climate change in mental health is also exacerbating the problem. So unfortunately, it's very difficult to tell our people how to be able to cope and create climate resilience without bringing, very fit for purpose and solid interventions on the ground. And that has informed us on how we can go about developing a toolkit, especially tackling water. And as we speak, more than 90% of our people lack basic water and sanitation facilities. So our toolkit basically highlights water conservation to avoid, water wastage, which we haven't thought about. Our toolkit actually provides standard operating procedures on protecting the basic water sources that we have. And during flooding, these basic water sources that we have, like wells and surface water, is actually becoming very, very polluted, with fecal contaminants, especially when we have poor environmental sanitation. Our water toolkit actually anchors on green materials on how we can treat this water at low cost for our people, and also depending on less energy and no chemicals. And this is the way we are trying to develop a community where we can actually, build on water, improve on water security, using methodologies that are providing net, carbon, as well as decarbonizing our environment. And it's actually built on the Sustainable Development Goals, especially SDG 6, and of course, on all the outcomes of COP27. Next slide, please. Next slide. So our toolkit, basically, we have developed indigenous knowledge. We have worked on indigenous knowledge on, trying to see how our people, many, many centuries and many years ago, how were they coping with water? How were they treating the water? So we gathered traditional knowledge. And we think that this is the time, this is the real time now for us to anchor on that traditional knowledge, because at that time, there was no really science and technology at that particular time. And in those days, they were able to still cope using indigenous science, indigenous knowledge. So we have actually anchored on that, collected such knowledge from our people, and we have been able to provide evidence-based science in terms of valorization, in terms of validation. And then we are now seeing how we can now take those proof of concept, build resilient interventions that can create climate resilience and improve on water equity, water security, and climate justice. Next slide, please. So we have provided in our toolkit, very basic community of practice protocols on how to protect water sources that we have at the moment. Next slide, please. And here is a simple, a protocol that normally it's built on the existing knowledge that we have, which has been very expensive for our people to be able to treat water. Now, I mean, just a few days ago, we all heard of Cyclone Freddy, which has hit very hard Malawi, hit very hard Mozambique, and we have more than 200 deaths and more than 2,000 people who are displaced. Just yesterday, in the Mount Cameroon, there was a heavy flooding, and it generated a situation where, it's been really affecting the mental health. We find people who are really suffering from eco-anxiety, eco-grief, and we've just developed a psychological term called mentademia, whereby because of excess stress, the blood percentage and the hemoglobin level of people begins to reduce, and we have evidence of that. Next slide, please. Next slide. Yeah, so this is our water conservation kit, and we are also trying to see how we go to communities whereby these communities have been affected by excess flood, especially with unprecedented rains and rainfall along the line, which has affected their psyche in terms of creating what they call ecopathy, in terms of creating distress, in terms of creating lots and lots of anxiety. And the issue is not just telling them how to cope with the anxiety. The issue is showing them this water conservation kit, that the little water that you have at home, this is the way you're going to use it. This is the way you have to prevent losses as well, not just using water lavishly. So we've got to protect these scarce resources. And this is the water kit, the tool kit for our conservation. There is so much details about this, but we cannot really explore that within this seminar. Move on to the next slide, please.
So,
now we began training people here, training children and schools on how to be able to, create this resilience. Next slide, please. Next slide. Yeah, and this is, we developed a Moringa technology for treating this water, which is available so they can cope. Next slide, please. Next slide. And that is a proof of concept. You can see the water there, dirty water, they can recover it using Moringa technology. Next slide, please. Next slide. Yeah, and then we built, a treatment system. That's a small treatment system we built in Cameroon to be able to, cushion the effect of mental health stress, but at the same time providing clean water. They can get to treat the water, and it's less than $20 to be able to set up one. And you can see the clean water there. It doesn't use chlorine, it doesn't use alum, and there's no point or no gainsay saying that how do we create water resilience when we start treating water using high technology that creates greenhouse emission. These are questions we need to answer. Next slide, please. And we're able to patent that technology. Next slide, please. I would like at this juncture to say, in conclusion, that we need local knowledge for treating water in order to create climate water resilience community and cushion the effect of climate change on mental health. We need to promote economic activities around water bodies and farming activities, drinking water, which is a very critical indicator for economic and socioeconomic development of Africa. So this toolkit is very, very important. It's built on water conservation, it's built on green technology, it's anchored on indigenous knowledge, and it has a multiplicity of benefits, both physically, socially, and culturally, and of course, mentally. I would like at this juncture to thank all of you.
Thank you so much, Ken. And we appreciate you giving us some ground-focused solutions as a method to mitigate some of the stress that communities feel so they can be water sufficient. Now, this brings us to our last segment of our session today, where we will have some insights, very quick insights. And I, once again, will request all the remaining panelists to stick on to the 5 minutes we have provided for the intervention. So the next set of panelists will give us a more of a condensed view on how disaster risk reduction, emergency responses, and water security settings also are part of this mix. So let's start with Jacqueline Lepi-Saskia of the United Nations Major Group for Children and Youth, Asia Pacific Focal Point.
Thank you so much, Nidhi. Distinguished delegates, ladies and gentlemen, very good morning, afternoon, and evening. So we know that all hazards have directly or indirectly connected to water, be it cyclone, floods, drought, to name a few. According to EMDAT, for the last 2 decades, flood and drought have impacted 3 billion people, and it also affected the mental health. So I have 3 cases from my work experience, which are based from India. So the Kerala floods 2018 and 2019. So they have a huge impact on the schools, and the schools were impacted, the toilets in the schools were impacted, which has a huge impact on the girls who were not able to use the washrooms and also have a scarcity of drinking water. Second is the flood on Assam in 2022, which had a huge impact on the menstrual hygiene of the girls. The Assam State Disaster Management Authority have set up a helpline service which is called Manojna, but due to the lack of funding and the lack of coordination between the departments, it has to be shut down. The last example is on the drought on Usmanabad district of Maharashtra, where there are a lot of dropouts because the most of the girls has been sent to fetch water for the family. And also there's a huge child marriages because to fill up the gap of the money which is required to run the family, they are being sold out. So these are the few examples from my experiences. And I see that due to disasters, which is related to water, has a huge impact on all these cases to the adolescent girls. As we can say that, and also has been mentioned in the beginning of the session, too much water and too little water. So with this, the last part which I would to highlight from these cases is that, and which is from a youth perspective, that we have to ensure that the community water infrastructures are shock responsive and are not disrupted in times of disasters, so that we don't hear the sad stories of adolescent girls. Second is we need to commit that all students go to school in spite of it being affected by disaster. So we need to commit to the school safety. We need to commit that all the girls have to go to school and should continue their education, and it should not have an impact on their future because of our water. It should be accessible to all. With these words, I would like to conclude. Thank you so much for inviting me to this important sessions. Over to you, Nidhi.
Thank you, Jacqueline. This was a very interesting message again on understanding the intersectionality between different SDGs, especially SDGs linked to education, water security, health, and education. So thanks for highlighting that. With that, I will give the floor to my colleague from UNU-MERIT, Dr. Dominda Pereira, to give us some insights from their recent assessment on disaster and health interlinkages. Dominda.
Thank you, Nidhi, and thank you very much for giving this opportunity. Good morning, good afternoon, good evening, everybody. I will keep my time on very short in my presentation. My title is Water Disasters and Threat to and Impact on Health. So as a disaster researcher, I try to break down what is the relationship between mental health and the climate change. And then I came out with a very simple diagram. Maybe I think all of you are very much aware of how we feel climate change. The primary media of climate change we feel through the water, like water-related disasters, like primarily they can be floods and drought. And then what are the impacts? We can separate into physical health impacts and the mental health impacts. And primarily, I think mental health impacts also we can see as a direct impact of floods and drought, and also as a consequence of physical health impacts, like they are correlated. And then if we check the very recent, the statistics about water-related disasters, and this statistics show the past 20 years. Like you can see, total number of affected is 1.56 billion people. It is 41%, and due to floods, and drought is 1.43 billion. And if we think about the number of deaths, and then again the floods and drought are very much dominant in the deaths also, and the economical losses. Like if we think about the losses, more losses come from the storms and floods and earthquakes, drought. But if you think about the climate change impacts, like floods, drought, and storms are very much common and dominant. So what I feel is like for the mental health, primarily the people get kind of mental health issues because of the losses. These losses reflect these statistics globally. Like if we lose one of our family member, or if we lose our livelihood, if you lose our jobs, if you lose our kind of crops or any kind of health, and then we get stress. And that is the most critical consequence of climate change and the disasters, and that is the chain reactions. And I think according to that, I can highlight what are the trigger points, like poverty, limited coping capacity with the disasters, and lack of psychological support during a disaster and after the disaster, and lack of counseling facilities at evacuation centers, and limited or zero inclusion of mental health in disaster preparedness programs. I think those are the kind of, in very short summary of the connection between disasters and its impact to the mental health and how to overcome these things. I think most of the disaster risk reduction programs and training sessions, they have kind of neglect, or they have not taken seriously about the mental health impact, mental health part, like lack of counseling, counselors, or lack of training and inclusion of mental health related topics in the disaster preparedness programs. And other thing is, without minimizing disasters, we cannot minimize mental health issues, that I believe. So these statistics, like for that one, we need to think about how to minimize or how to reduce the risk of disasters, like developing early warning systems and improve community-based coping capacities, and improving community resilience, and then improving and empowering communities for the both physical and mental health. Those are the kind of actions we can take to minimize mental health. Having said that, I will conclude my short presentation, and I would like to invite you to read our recent publication about water-related disaster and their health impact. And it is a global review. We studied about 35 case studies, and then we've summarized very interesting facts and figures for you. And having said that, I will stop here. Thank you very much, Nidhi. So.
Thank you so much, Namit. I really appreciate you keeping on time. And maybe we should now hear from our last panelist, Elena Lopez-Gun, the director of Catalyst Spain. And before we go into an interactive discussion, let's hear what the Spanish are doing in handling this situation. Elena, up to you to give us some insights.
Can you hear us? It's okay, no?
Yes.
Okay. Yeah, I'll try to be very quick. So hopefully I'm trying to make it go full screen. Okay. So just to say that I'm actually presenting with a youth, Anna Wendy. So, okay. So just, I will try to be very, very quick. And it's just a collective presentation for myself and also an environmental psychologist that works with us, and Anna, who actually did a survey on purpose for this presentation. Okay, so I think the quick summary is that we have a big issue. We're based in Spain, and we're already experiencing the impacts from climate change. And this idea of combined risk, and the emerging evidence that we're going to present today is just a survey we did on 17-year-olds, on how they actually feel about eco-anxiety. And then what is, I think, to us most important, which is some ideas for action. So as you can see here, we do have a kind of combined problem at the moment. We have, in terms of Spain, we have a very high school abandonment. We have a very high school unemployment, the highest, well, some of the highest in Europe. They're leaving home late, so there's issues about access to home. But at the same time, what we've already seen is the suicide rate in Spain at the moment is almost like a second epidemic, because we were confined for a long time, one of the hardest confinements in Europe, in the world, actually. And we are now seeing a doubling up of adolescent suicide rate. At the same time, we're also seeing the climate change impacts. We're seeing, for example, that the Danas, which is this very extreme flash floods that happened in the eastern part of Spain. And I've put a reference here to a study done in that area, led by a professor who actually researched the impact, particularly on adolescents. Droughts, for example, we now know that it's starting to affect young farmers, which have a problem in entering into that sector. And then this summer, I haven't heard yet anyone mention heat waves. That for the Mediterranean area was a huge, huge problem, and for the Middle East, these temperatures rising on top of 1 degree temperature increase already from climate change is actually going to be very dramatic. So what we did, though, is to present, with the reason of this meeting, Anna Wendy, who's sitting with me, did a survey of her led by her, written by her, with the support of psychologists, to get some insights into what youth actually think. And the issue of eco-anxiety, as you can see there, most of the students, 70 students actually replied in a relatively short time, so they were quite committed to participating. A bias towards young women rather than men, so I think that in itself is interesting about participation. And as you can see here, most of them are actually motivated to take action. I think this is a very important message, that we actually have youth with mental health problems or increasing mental health problems, but it's not because they don't want to do something about the issues that they're facing. I think this is a very important message coming out from this survey. Also, that they are scared. They are scared about the unpredictability of the impacts of climate change, that they're actually worried about the impacts of natural disasters. And this unpredictability in the system, I think, is actually a factor in how they're feeling about, climate change and the impacts. Also, that the kind of concern about the future of the planet. They see it as a kind of bigger picture in their feelings. That is about the planet that they're inhabiting and the future that they have. So I think in terms of, what can we do in terms of finding hope? I think, again, we have some results from the survey that are really interesting. First of all, and I think maybe Anna can, no, she's not, she's a bit shy. Okay, so communication, I think some ideas on the new channels, that I think we have to understand, and this for me was a shock when I saw the results, that they don't inhabit the same spaces that we do. I think this is very, very important if we want to communicate effectively with them. And then just some ideas on the kind of things that I think we could do. So the first thing you can see there, social media is the first, and then friends and family. Okay, this is only Spain, but this is important because we have to then understand the role of social media in relation to mental health and reaching the youth, because that's actually a main channel that they are now interacting with. I think also, and to me, this again was super, super interesting finding, the barriers to acting. The first one is they don't know where to start, but they also have lack resources. So again, a message for us adults, to help them, act, it's in our hands that they can actually mobilize this section of the population that is actually very keen to act. And again, I think, and it's actually kind of linked to this, when they're thinking about climate change, this is actually related to their feelings. And the first feeling is kind of lack of possibility to act. They feel very powerless. And I think this is, again, very important to empower youth to be able to act. They have a lot of anger as well. They have a lot of fear, and they have a lot of anxiety. And I think these feelings, we're going to have to find ways of managing these feelings on top of the fact that we have the impacts, like the floods and the droughts. And then I think on a positive note, I just want to share with you some of the things that the EU is doing at the moment. They've developed a green competence framework. And this competence framework, for example, it has one about values, some about understanding complexity, some about vision in the future. But I think for me, what is particularly important for what we're discussing today is that one whole section on the education of competences is about acting for sustainability. This idea of empowering them to be able to act, cope with these feelings, of fear and concern about the future. And then again, some ideas of the kind of work that we're doing at the moment. Albert Einstein saying that games are the highest form of research, and how we're now developing games for youth, different ages. So we're developing games for primary, for secondary, also technology. As we've seen, social media technology is a big inroad for them. And at the same time, you're actually empowering them by skilling them for a very, very uncertain and changing job market as we move on into the 21st century. For example, we did a game on pollutant attacks, and they killed the pollutants. So then it's kind of like really active for them, so it empowers them about understanding air pollution and this idea also of citizen science, so then they can denounce when they have issues happening in their own environment. And then, for example, we're also using drones, so they can take measurements of air quality in their local schools, and then they understand the issues of, for example, of course, air quality, heat waves are very, very related, for example, in a country like ours in Spain. And then with that, I think this is my last slide, that education is the most powerful weapon which you can use to change the world. Thank you very much.
Thank you, Elena, for all these inspiring messages in tandem. I'm sure that we should embark our channels for engagement, as you pointed out, depending on our target audience. And for youth, it can be different for adult population, for aging population, it could be different. So I think thanks for giving us that insight from Spain. And in the spirit of some discussion, which we can have in the remaining of the time before we get our closing summary from Robert Oakes, I'd like to maybe put some people on the spotlight to get some more advanced comments. Maybe I'll put my colleague Dominda on the spotlight and ask him, Dominda, how do you see data gaps as a barrier in conducting and examining the water and the health nexus, especially in the context of mental health?
Yeah, thank you, Nidhi, for the question. Yeah, actually, when I was doing that review, I was checking for data, and then I found, especially what we talk about SDGs, because SDG has a lot of goals and a lot of indicators and a lot of data collection venues. But unfortunately, when I check for the disaster-related health data, they don't have a specific indicator. They have, like, it is scattered between SDG 1, 3, 6, 11, and 13. But in the water-related disaster context, there is no indicator to measure especially the mental health. That is one of the limitation. And again, they have WASH data for the SDG 6, but it is for the general situation. But especially for the disaster situation, I think mental health and the physical health scenarios are very different. But unfortunately, that is one of the missing part in SDGs also. And in the general context of also, I think you all agree that lack of data is a big challenge in everything, but especially for the mental health, I believe very, very limited data. Maybe I think the audience also can comment on that one. Thank you.
Yeah, is any other panelists keen to add their insight to this question? Go ahead.
Yes, I agree wholeheartedly. And as grassroots actors, we see every single day that the reality on the ground is often very different from what is actually reflected in data from high-level institutions, because they just don't take into account ground-level realities and the lived experiences of the people. And more often than not, it's the women and girls who are most affected, because as we've seen throughout with data gaps in gender, women and girls as issues are most often just swept under the rug, and their mental health and their mental well-being is really no different, particularly in climate vulnerable areas suffering from water scarcity. So it's really important in this aspect to ensure that grassroots actors such as us who do collect data, there needs to be this normalization of civil society collected data that's actually understood to be valid to reflect these ground level experiences, along with, of course, data collected from high level institutions, because that is just one way that we'd be able to bridge this tremendous data gap that does exist. Because without these voices from the ground level showcasing, speaking out on their own, we'll not be able to address their unique vulnerabilities, and we'll continue with business as usual. So there needs to be this drastic change in how we view our data collection so that we're truly able to address these data gaps.
Thank you, Kekashin. Now I'm going to just put my directional angle to Europe, and I'll ask my colleague from Italy, Matteo. How do you see that local initiatives or local government or subnational governments, provincial level, are taking note of this need? And what kind of efforts are put in place to support communities and populations?
The awareness about climate change in Italy is very low, and there are some different NGOs that are improving their effort to implement mental health and to implement awareness about climate change. But there is awareness and concrete act to handle climate change and to handle the crisis of the water, because in Italy we are facing a very hard period of drought, and institutions are not making an effort to face this crisis, and this is very awful, because people, mostly young people and mostly female young people, are suffering for this crisis. Our organization, that is called Italian Climate Change Anxiety Association, is delivering mental health support not only to people that are suffering from climate change related mental health problems, but also to activists and people and researchers and scientists involved in this problem. And we are also trying to communicate with other organizations to improve awareness among population. But Italy is it's very it's not facing in the right manner the water crisis, and this is very sad, because Italy is it's very affected by the climate change crisis, but also by droughts and water scarcity. And we have a lot of agriculture, and our economy is based on agriculture and other things related to water, and mental health of people could be extremely affected by the water scarcity and in the next years. And then we have to improve our strategies and our efforts to handle this problem.
Thank you so much. At least it looks like there are some gaps and needs at the country level, but taking examples of other countries or at the regional level of the European Union efforts or the European Commission's programs, there could be some synergies that could be explored and scaled. So we do have hope, as Alina pointed out. In the context of time, I'd like to give the last question to my colleague from Africa. So maybe Deodata or Ken, would you like to just give us an insight? What are the incentives for communities to add on to this extra work of collecting data, trying to volunteer on some programs, trying to co-organize? Are there some incentives, like some funds given to communities? Because we may see a number of needs in different intersectoral issues, but then it is an added burden on communities to do more than they can or they have capacity for. Ken, would you like to take this?
Yeah, okay.
What kind of support is available for communities, financial capacity?
Yeah, thanks so much. I think that the situation is not so clear and not so easy, because at least we should work integrally, no? It means sector with the population, govern, even the partners, because the community needed to be supported and need to be clarified on the issue regarding change behavior, but they should be helping, because they don't have enough condition to support the way of the life. So I think the better policies, the integrality, no, even the political decisions should be made in place. The situation to integrate the sector, the private people. I mean, this is a national policy together with some international partners, just to continue making place frequently that the issue. It means that we should be together, but frequently on this matter, in the way integral to get a success joined with the community. This is my point of view.
Thank you so much, Judetta. We take your point on making integrated solutions in which community has a role, but also has support. Last was to you, Ken, before I give it to my colleague to conclude the session. You're muted.
Okay, great. Yeah, I think first there is a data gap. There's a paucity of data for people here to see the connection between the water crisis and climate change and mental health. There's a huge data gap with respect to that. And first and foremost, the stakeholders, just like the previous colleague has highlighted, the stakeholders in the political arena, and of course, even major NGOs do need more enlightenment on how to see that connection between climate change and mental health. We have to start from there. Without that, I'm not sure. And right now, as it is, there is no, there's a political will and financial support that can trickle down to community in order to support and create climate water resilient communities. Is not yet there. So it has to start from the information gap, to fill that information gap, create that data, bring in the stakeholders to understand, and of course, begins to have that support, political support that can trickle down to the communities. Over to you, Nidhi.
Thank you so much, Ken, for again putting this in context. I will now ask Robert Oakes from UNU-EHS to give us some closing summary for the session.
Thank you, Nidhi. Thank you for organizing, and thank you also, Sanae, and thanks to all the speakers and those joining us. I think it's been a really instructive and interesting session, and particularly on the day that the IPCC synthesis report has come out. So it's really vital to bring these elements together. So we've got the nexus of water and mental health, which is occurring in the context of climate change, of course. And the report essentially said today that, yeah, we may be overshooting. It may be that 1.5 degrees is going to be exceeded, but there's still time to act. I think that's very appropriate for our session. So we have these issues that have been identified to some extent, but there's still something which can be done. So I'll very briefly just cover this angle in terms of research and policy and practice. So in terms of research, we had a nice introduction to what is this connection between mental health and water in the context of climate change. And it is a really new field, as has been explained. You know, there's not been many research projects looking at this, and there are, as have just been mentioned, a lot of data gaps still. But it's really important that we kind of explain this, the holistic nature of this, this challenge, really, because we can't really disconnect the mind and the body. We had some examples of saying how physical health impacts on mental health, and of course, vice versa as well. But also, if and when mental health is affected, it can relate to other aspects of an individual's life or a community's life. So we looked at ideas of how education can be affected for children and girls in particular, and how this relates to personal security, for example. And of course, there's the kind of ever-present idea of vulnerability. So as in any instance where someone doesn't have access to a resource, it's the vulnerable members of society. And of course, it's the countries in the poorer countries in the global south, but also within those countries, it's vulnerable communities. And we heard a little bit about how this is qualified and conditioned by gender, by age, by disability. But of course, we could have extrapolated to different ethnic groups as well. But yeah, we had some really interesting, useful, sometimes difficult examples from Sao Tome, Anguilla, Nigeria, Kerala, Palestine, just showing this kind of imbalance. And we had this nice idea that this challenge is different across time and space and through groups as well. And this kind of brings me to the point of policy. So something, of course, needs to be done, and we've addressed some of these ideas. So governance came up, and governance of water itself, the way that water is managed. But if we could think more broadly about climate governance, and this brings into ideas about loss and damage. And of course, there's the funds to address loss and damage, which may or may not come into fruition in the next few years, and how this can kind of interplay with mitigating it against the impacts of mental health, but also treatments as well. And I think it's very important to recognize that this is all happening within the political economy. So it's the way that states are controlling water, or how water is controlled within states, and then within society who has access to this water and why. And this went into this kind of short discussion we had about who owns water. Is it public? Is it private? Who has access to that water? I think this is very important. And then finally, we had a little discussion, various ideas on practice. And I think what was really clear was the idea that it's really important to empower communities. And this was perhaps through participation, and efficiency and efficacy came through, about enabling people to actually build resilient lives. And there were some positive aspects as well. It was nice to hear about some interventions which have been successful within Nigeria, within Kiribati, within Bangladesh, whereby we're having to bring together the elements of mental health, water, climate change for sustainable agriculture, more sustainable livelihoods and pathways that we look to achieve in the future. But it should be acknowledged that in terms of actually treating mental health disorders as well, we said that there are 1 billion, 1 in 8 of global society is affected. There needs to be a bit more emphasis on training psychologists, psychiatrists to be able to study and give interventions on these conditions. I guess just to briefly wrap up, as we're running out of time. So if we're serious about achieving Sustainable Development Goal 6, and indeed all of the Sustainable Development Goals, we really need to kind of bring together and make a concerted effort, as we mentioned, in terms of research, data, the understanding, the compound nature of these risks, applying pressure and producing research to help guide policy to protect people, to avoid these losses, but also learning from practices about how to enable people, empower people with sustainable options to protect their mental health or adapt to the reality of climate change and/or aspects where water availability is problematic. So this will help us to reach a sustainable, equitable, just and empowered future in which everyone has this availability to sustainable management of water and sanitation, as Sustainable Development Goal 6 aims for. Thank you very much.
Thank you, Robert. This was nice to have a little summary of what we heard from our spectrum of panelists. And having said that, I think it's I hand over to Sanae to give a very, very quick closing comment. We are already over time, and I thank you once again for joining us in this panel. Thank you.
Thank you very much again for joining us and also sharing your very, very valuable and deep insight with us. And we would like to, follow up with you all and very soon. And also we would like to extend our sincere gratitude for the local support to host this event from our colleagues as well. Thank you very much again for your time, and we wish you a very nice afternoon. Thank you very much.
Thank you very much.
Thank you very much. Have a nice day.
Thank you. Event is closed.
Thank you.